Hi everyone, my name is Micah Guidry. I am the manager here at LaBelle Cosmetic Surgery Center.
Hi, I'm Dr. Jay Apurav. I'm the cosmetic surgeon at LaBelle.
We're going to talk about lip enhancements and the different options out there for you and what you can do. So the two main things we're going to talk about is lip implants and fillers.
Yeah. See, beautiful lips says a lot of things. Beautiful lips are first thing you see in many people, and the lips, of course, gives it away if it's very thin and thinned out and lost volume. So lip enhancement is a very common procedure we do. But most commonly, most people do a hyaluronic acid injection to the lip to enhance the lip. And that's the most common thing we do routinely. Things like Restylane, Juvederm, and Bellatero are hyaluronic acid based injectables. We inject on the lips, make it look better and beautiful temporarily. It's an immediate result. You can go home with it, come back 6 months, repeat again, keep doing it. That's the most common thing we do. But some people require long-term results. Then we can do some permanent enhancements. Initially, we like you to still, even if you're considering a permanent enhancement, I'd like you to consider doing lip enhancement with injections first to see whether you like it or not. Then you like that appearance, then consider that. There are many things you can do there. Most commonly, we can inject fat, we can inject silicone, we can also implant foreign objects in there, like Gore-Tex material. It's called Advanta graft. It's actually cylindrical graft that goes inside the lips with a tiny hole in one corner of the lip to the other, and it's permanent. Once the wound heals, it's permanent. We can do that. There are also pre-shaped lip implants made of silicone is also available at this time. And the newest one is an implant that's available with a lip shaped but collapsed back. You can inject saline into it and make it look the level you want, the way you want it. But that's a newer implant. It's to be studied properly. So we can do that rather easily. This can be considered.
Yeah, and like Dr. J said, we do encourage our patients to get lip fillers first. Let us inject them, look at it, see what you like, and that better helps us decide for a more permanent option what goal you're looking for. But just to kind of reiterate, patients that are getting fillers to the lips, one syringe is typically enough for a patient. And that's any brand that you choose, whether it's Juvederm, Restylane, Bellatero, any option out there. The new trend is the Kylie Jenner lips that have way more than one syringe. We at this facility do not tend to do that. We want you to look natural. We don't want it to look like you've got big fillers in there. But also you have to think about the more you're stretching that out, that's not something that you necessarily can maintain the rest of your life either. And lips will become frail later, too stretched. So those are different things to consider, but like we said, one syringe is plenty for patients to achieve a result that they're looking for. And then if you really like that, more permanent options are available.
Yeah, people usually come to me showing me a picture of Angelina Jolie to make her look like that. It's not like that. What we do is make your look the best it can. It's not going to look like somebody else's lips. But that's what you want. I mean, you need to look your best. If I put Angelina Jolie's lips on your face, you may not look right at all. So it's something to consider. It's not somebody's lips, it's your lips that you need to be looking better with. Another thing you have to know is between the permanent fillers, the foreign objects we put like Gore-Tex, it's called Advanta graft or a Surgisil, we can remove it if you don't like it. But fat cannot be removed. Fat transfer can be done in the lip. One issue is when we put fat, for example, in the butt, 70% we can make it survive. In the lips, it's not so. Survival rate is less because lip is a mobile organ. You're always moving it for every day, all the time. So mobility controls the survival of the fat cells that we put in. So very often, when you put fat in the lips, we almost definitely let it come back for another time and maybe 2 or 3 times to finally get ultimate results. Silicone is the other extreme. Once you put it in, you can never take it out. So if you don't like it, you're stuck with it. So don't even, if you do not recommend putting silicone, even though a lot of people do it, that's the way it is. So remember that if you don't like it, we can take the implants out easily and get back to what you used to be. That's something to consider. And implants rarely have a complication, maybe 1% chance of them getting infected and all that. Then we can take it out, remove it, and that'll be all that's required.
So just remember, this is a lip enhancement procedure. This is not a reconstructive or redesign of your facial features. So if you're looking into that, come and see us and let us help you achieve what you think is beautiful to you. Thank you.
Thank you for listening.